we are the Health Sector Board of KHF. KHF is the apex body of private sector in Kenya, and it basically is structured in sector boards. And the sector boards mirror the government ministries. So we have Health Sector Board, we have Tourism Sector Board, we have Trade and Industry, and so on and so forth. So we are the Health Sector Board of KHF. Now, most of the sector boards are still technical working groups within KHF, but as Kenya Healthcare Federation and a few others like tourism and ASNET, agriculture, we have registered ourselves as company limited by guarantee, of course with membership, and so that's who we are. So we are the private health sector voice in Kenya, and we have that moral authority and mandate. We do plug a lot and very actively, and we inform the health agenda at the KHF, but also, which essentially informs the country health agenda. Of course, we have a lot of deliberations and collaborations with the Ministry of Health, the state agencies, the Treasury, but of course, KHF comes in to put in a lot of force or a lot of, to amplify the voice, because of course their voice is bigger than ours, but our technical expertise is what we feed in to make sure that the health agenda is in favor of the private health sector, yeah? And when we say private health sector, for us is, your health institutions, associations, your corporate, NGO, and social enterprises, and your professional associations as well. So really, we are looking at, and it's part of our mandate for the new, strategic plan, to actually now really become a force to reckon with, to really shape the private health sector. So one of the things that has come up also is we were challenged, and we have actually revised our mission, vision, and core values. So you will see a lot of new branding, new stuff, but basically we're looking, more futuristic. So our vision has been revised. And again, we can take this as a validation, so give us feedback as well before we finally, roll it out. So we're looking at, our vision is to be the leading membership organization advocating and supporting health in Kenya. And our mission is to champion the interest of our stakeholders through transformational advocacy and support. Yeah, transformational advocacy and support. And our core values are accountability, collaboration, innovation, and agility. Of course, just to remind you that we were founded in 2004, we were registered in 2008. In between there was a lot of due diligence being done by the government. And we've been in existence since then. And I think we've achieved quite a lot. But I think we've just only scratched the surface. So we know we organized in 6 thematic areas, which mirror the WHO's health systems. And it's, again, that is what informs our technical working groups or the technical committees. And you will meet the technical committee leads before, as part of the last session today, because they are going to take us through what is it that they've been doing. And I really urge each one of you to make sure that you're represented in each and every of these committees, because some of the issues are cross-cutting, you don't know what is being done. For example, the NHIF topic, yes, it's healthcare financing, but at the same time it's about policy. So a lot of cross-cutting issues. This is your board and your secretariat. Yeah, just how we engage at all levels of government. And also, we also engage a lot at private development partners. Of course, we also collaborate a lot with our members as well, as you may be aware on some of the projects that we have done in the past. Of course, our liaisons, both at country level, at regional level, and from a development partners perspective, what I can tell you for a fact is the fact that the development partners are now paying a keen attention to Kenya Healthcare Federation. Because of course, as you know, the journey to self-reliance involves having the private sector on board, which is a good thing for us. Of course, opportunities for strengthening the regional coordination. East African Healthcare Federation we are a founding member. They will be having a conference towards the end of the year, but we continue also to have board meetings just to discuss the issues. We've just actually concluded a regional project between the East African Healthcare Federation, which is Bill and Melinda Gates. It was a Bill and Melinda Gates funded through Africa Economic Research Consortium, and KHF was the lead implementer. And at that time, Rose she was an intern, so she's one who led that project very well. So just to tell you the opportunities, and also, Kenya being a hub, we provide you a platform also to give you linkages as you expand in the region and also in the continent. So that's an opportunity and a value proposition we give to our members. Here you are. We currently have the highest number of members ever. So we've just hit 180, and we are growing, a lot of interest. But from a strategic perspective, now we're actually even going to do it a lot more. So we will probably be hitting maybe 500 plus. It's not in the numbers, just to make sure that, you don't struggle out there alone. You belong to an organization that can actually amplify your voice. And I think that is very important, because you've seen what has happened, for example, these organizations that has been suffering with the KRA. When you look deeper, they didn't belong to any organization. But essentially they belonged, and they were able to have a favorable outcome at the end of it. We are not promising anything, but we're saying we can actually, help by it. One of the things that we didn't know, and this was brought up by Dr. Mwaniki, thanks for that, is that Resolution Health, I didn't know as a secretariat that we had issues. It's not that we can resolve anything, but it's that what can we do as a general membership in health with a stake, because it's affecting everybody. What can we do at the regulators? What voice can we take to the Ministry of Health? What can we do to the affected parties? Because it's everybody across the board. Because if it's affecting the hospital, it's affecting the supply chain as well, and the consultants, etc. So those are the kind of things we are saying. We come together to actually find win-win solutions for such situations, may they befall you, but also the good stuff, or things that we want implemented. So the importance of belonging. So anyone in health, feel free to urge them to join us. What we are known for, or what we do, our main thing is advocacy. We provide opportunities for networking. The CEOs will have an opportunity on 7th of April also to really be closer to the board and tell them what are the things they'd like to see differently, what are the things that would like us to focus, what are the things that like us to stop, etc. Yeah? And then engagements, projects, and regional integration. If you don't see a logo there, then it means you're not paid up in 2022 or you're a newcomer, so don't worry about that. But we're urging all our members, by the way, if you have not paid, the deadline is next week Thursday, tafadhali pay so that at least we can be sustainable from an operational perspective, at least to meet the basic operational costs like salaries and so on and so forth. So, so that's so in terms of impact, it's across the board: policy, regulation, advocacy, regional integration, and public-private dialogue. By the way, from a regional integration, at the end of May, we'll be having a Expo, East African Health Expo, which is it's to be co-hosted by KHF, Strathmore, and the UN SDG Partnership Platform. It is happening, and it is moving at speed. It is the next thing that we'll start now, communicating starting tomorrow latest. A lot of opportunity for those who have also regional interests, and give us feedback as soon as you see our publication here. But also public-private dialogue is very critical, because we are not our moral authority is not to go to the streets and raise flags or banners, but it's to really have a dialogue, because you only get solutions from people who you can dialogue with, and you come up with a win-win situation. So it's not an issue of my way or the highway, but you meet in between. So let me go back to the strategic plan. And on the strategic plan, so basically the Kenya Healthcare Federation has now developed a new strategic plan for the period 2022 to 2026 with two main factors in mind. One is on the leadership, the other one is on growth. So in terms of leadership, the directors has given directions to the management to review the previous strategic plan, which we did together with a consultant, objectives and performance management measures to ensure that they're aligned to the vision and mission of the organization. In terms of growth, is the need to establish a high extent of achievement of the goals and objectives of the previous strategic plan and identify the performance gaps and key lessons learned by the organization. So after reviewing and sitting with the consultant, so we reviewed our mission and vision and our core values. It was a very open and candid discussions. We were really challenged. And I can tell you that by the time we came out of there, we were like, wow. Yeah, so that for us was an important one. So in terms of, so we reviewed what we've done in the past, come up with a new strategic plan. We've come up with new vision and mission. But what we must remember is to maintain 4 thematic and key resource areas on which to focus on. I can tell you in the previous strategic plan, which remained in draft for forever. It was never implemented, but we still implemented a good portion of it. It had 7 strategic pillars. You can imagine, you don't know where to focus. But now we are very, very, very focused, yeah, with very key deliverables behind each of them. So the first one is financial sustainability to increase resource mobilization and operational excellence. And I like the word operational excellence because that is what will take us extremely very, very far, and also will give us the credibility and the image that we would like, that we duly deserve. Let me say that. And then stakeholder management, enhance staff satisfaction, corporate governance, and advocacy. And these things include mapping out who are your stakeholders, right from in-house, outside our members, etc. And then strengthening the institutional capacity, increase stakeholder satisfaction and strategic communication. You are part of you are the main stakeholder, you are main stakeholders of the organization, so we need to make sure that what we're doing is in line with what you desire. Yeah, and then also now strategic partnerships, attract, engage strategic partnerships. Just short and sweet. But it has a lot of stuff behind it, yeah? Okay, so these are the 7 focus areas of last strategic plan, which remained on draft. I repeat again for the nth time, because the board was very mesmerized that we didn't quite whatever, but I must say we did quite a lot with the resources that we had. And then, from a secretariat perspective, there are learnings that we take forward on how we should do things. But more important, when there are so many activities, tracking the implementation becomes a problem. Yeah, we did do a situation analysis and environmental gap analysis scan, just to allow comprehensive and detailed documentation of the process and outcomes. We will share this document for you to really internalize it and look at it and give us feedback before we finally finalize. And then we also conducted a SWOT analysis to determine our position in the health industry. And you will see from this that we really have a huge potential. We have a very huge potential that is not tapped. And that is a good place to be. But of course, the challenge is that, how do you ensure that you structure yourself, you resource yourself to achieve that? So that's very critical. We also mapped out key stakeholders that will be engaged during the next phase of a strategy. So you will see we have, of course, the public, and I think one of the people that we need to bring on board will be your patient groups, for example, but also the general public. When good stuff happens, we need to, also communicate as much as when, challenging situations happen. We have to be out there at the forefront as the health sector lead, giving our perspective, our strategic position papers, policy papers, and so that's one area that we must be to be seen as the the health sector opinion leader. That's very important. Also, the development partners, I've mentioned that, the county government. For those of you who are in the development world, there's an offer that has been issued by USAID on a local development organization or something. It's about not staying, not having just umbrella organizations at the top, but also how do you develop structures at the county levels to better engage. So that's an opportunity for us. But for us as KHF is how do we have very good structures and PPDs, public-private dialogues, between at the national level. How do we cascade that down, either from a regional economic blocks, as the counties are, or even down. The good thing, again, is that we have very good relationships with the COG at all levels, and now it's an opportunity for us to really get engaged at that level. And also to make sure that, people don't feel that we're just in Nairobi and as a national. Even the private sector person playing in any of the counties has a voice, either at the county level and, cascaded upwards to the national level. The hows are things that we can think about and whatever that, and see how to. And then, of course, the government, ministry, then we have the agencies, we have the regulators, we have the Ministry of Health, the people we are so used to engaging. Then we have those members, employees, banks, insurance companies, training and research institutions, very important for innovation, parliament, and media. So media and parliament, we have been very weak over the first couple of years. But again, you can see we're starting to walk that journey. Yeah. We have already anticipated some risks we might face as an organization in the strategy implementation and developed some mitigation measures. So some of the risks would be cybersecurity, your usual corporate risks, I guess. Yeah. Operational risk, social license to operate, organizational resources, and of course, legal risks. And then we have to be very strong in our monitoring and evaluation. I think this is somewhere also which has not been quite existent in our operations, but now from a strategic perspective, we are focusing on it. Yeah. So that's it on the strategic plan.